Hi, my name is Alexandra Gomes and I'm a LSE Research Fellow and I work mostly on social spatial inequalities. This is a project called Deconstructing Health and Wellbeing Through Data, and it's a collaboration with the LSE Data Science Institute, the Ordnance Survey through the Public Sector Geospatial Agreement and the NHS. And we are looking into how data can help us understand the perceptual and emotional side of how people relate to their own public spaces, their local public spaces, and how that can help create a better value for neighborhoods and cut costs for the health system. So this project aimed at understanding the role of placemaking in health and well-being, and in particular what type of interventions we can create and invest on to reduce local disparities. So we basically did a kind of an assessment of the value of green spaces and parks in particular, and we looked into 3 parks in Haringey with different sizes, and we explored not only the spatial side of what brings people to parks, but also the social and emotional side. And we tried to understand from surveys and interviews what really matters in people when they use their local parks and what attracts them to one park more than another. So this study highlights different factors. One is the elements of a park, which include green spaces, but also social spaces, which are fundamental for people to get an attachment to the park itself. And those include, for example, cafes, social hubs, but also sports areas and playgrounds. Another element is unique features, for example, because people are attached to particular things that exist in a park more than others, and they might be attached and not use it. So that's quite important to highlight. The other element is perceptual. The perception of safety, the perception of cleanliness, the perception of how accessible the park is. And we're talking about accessibility inside the park, outside the park, but also accessibility in terms of affordability. Can people have access and pay for example, sports areas in the park? And we also realized that, this is how we implement things in the park, but then there's thresholds and there's interrelationships between the elements that are important to highlight. For example, what's safe for someone might not be safe for another person. If you add more light, you might be creating light pollution. Or, for example, if you have a park that has a lot of dogs, some people might be comfortable with that, some people might be less comfortable. Other issues is physical barriers. When you implement, for example, a physical barrier for motorcycles, you might be creating a physical barrier for wheelchair users. So these interrelationships and considering parks as part of a system was something that we found out. So we've realized in the end of the study that there's a lot more that needs to be explored. This is a pilot study focusing on Haringey. We also realized that for real placemaking and for engaging people with health and well-being in their communities, we need them to have also decision-making and a bit of funding, and that was what we saw from, in particular, one of the cases. And finally, I think the relationship with the Ordnance Survey is fundamental because we are trying to help create data and translate emotional and perceptual data into spatial data that will be able to analyze and assess the value of parks in the future, and that will help practitioners, designers, and those who want to improve health and well-being in the UK.